So I'll start with the key points in mind, the take-home points for you. So number one, Wilson disease is chronic and requires long-term care throughout the course of your life. Number two, symptoms of Wilson disease can improve with treatment, but it's not a guarantee that with treatment, all of your symptoms will improve. You will hear later today about controlling neurologic symptoms, in particular neuropsychiatric symptoms, motor symptoms, and other symptoms as well, liver disease included. Monitoring is through lab testing, urine, blood, clinic visits for physical exam assessments, and imaging, which will be expected to continue again in the long term. Number four, special circumstances in Wilson disease are vulnerable periods during the lifetime of one's care, and special attention needs to be paid during those vulnerable periods because they are times when one has the potential to become sicker. And number five, those with Wilson disease do have to modify their lives in some ways, and hopefully it's manageable, but I will discuss this briefly as well. So for your reference, most practitioners who care for patients with Wilson disease will likely reference clinical guidelines, and these are the two most up-to-date and largest guidelines that will likely be referenced so that you're aware. The American Association for the Study of Liver Diseases, Multidisciplinary Approach to the Diagnosis and Management of Wilson Disease, and the European Association for the Study of the Liver, published in the Journal of Hepatology, Clinical Practice Guidelines on Wilson Disease, published this year. So, the first point, Wilson disease is chronic. It is a genetic disease. Copper buildup occurs through one's life and needs ongoing management. How much aggressive management differs from person to person, but the point is that it requires long-term care. And so, continue follow-up with your provider, continue monitoring how aggressive it is, varies from person to person. Wilson disease patients are often younger relative to other liver diseases. The onset of this disease tends to be in the 20s to 30s, and so younger relative to other liver diseases. And so it is the case that one encounters this disease younger in your life, and it's a disease that you grapple with at a different phase in your life compared to other people. But it is also something then that you must contend with in the longer term as well. And symptoms can persist after treatment and requires continued management as well. The treatments that were outlined by Dr. A would be expected to improve symptoms, but aren't necessarily going to resolve all of your symptoms guaranteed. So specifically, the symptoms that we refer to are those of advanced liver disease. So with progressive fibrosis, scarring of the liver, one can develop cirrhosis and develop symptoms from that, and particularly the neuropsychiatric symptoms that can develop as well. So the symptoms can improve. Any improvement has been estimated to occur at a rate of 78%. So most people have some degree of improvement. Again, how much improvement varies from person to person. In terms of the liver, markers improve in approximately 50 to 60%, and it can take some months as copper stores are gradually reduced to a normal level. The neurologic symptoms can take longer. It's thought that it can take years, and occurs at a lower rate, 50 to 60%. But note that, again, as was mentioned in Dr. A's slides, that as treatment starts, that paradoxical worsening of your neurologic function, but also your liver function can occur in a small proportion of patients despite treatment. And so Dr. Alexopoulos will talk about liver transplant and its role in Wilson disease, but also there is the adage of start low and go slow with these medications, and then also close monitoring at first, which is gradually spaced out as things stabilize. So those who have a new diagnosis of Wilson disease, of course, we keep a close eye on you. In terms of disease monitoring, a close history to try to identify symptoms and examination, particularly a liver-specific and a neurologic examination, blood counts, electrolytes, liver chemistries, to monitor your liver function in particular, blood-based tests of copper and those who are on zinc for zinc levels as well, and an imaging test to look at the liver, but then there are also specialized tests to monitor liver scarring, fibrosis. Elastography is sort of what they're generally classified as, but these specialized tests to monitor whether there's any liver damage. And if one does have cirrhosis, severe scarring of the liver, then subsequently there's additional testing that would be performed as well on those patients. This is copied from the EASL, European Association for the Study of the Liver guidelines, as labs that we are recommended for monitoring, but they generally center around the 24-hour urinary copper. And so that is a bread and butter monitoring test that is performed on patients in order to monitor how much copper is being excreted, and if one is on zinc as well, a zinc level in the blood also. But the concept, though, is that we do want better tests in order to measure how much copper is inside of us. And the idea is that ceruloplasmin is the protein in our body that helps to protect us from the harmful effects of copper. And it is the case that copper that is not bound to ceruloplasmin has the potential to hurt us. And there's been, in various stages of development, various non-ceruloplasmin copper tests that are being investigated. And the relative exchangeable copper actually is available in some countries in Europe and in India as a test that is recommended by EASL at this point for monitoring. It represents the labile copper pool. Again, the copper that is toxic. It's been found to be accurate for earlier diagnosis as well as treatment initiation to make a decision, but also for monitoring, and so it's recommended as part of their guidelines. It's not routinely yet available in America, but it is the case that individual centers are trying to make it available for monitoring. So there are other tests that are also in development, the accurate non-ceruloplasmin copper, and so that is a direct measurement, and it's been found to be a possible diagnostic test for acute liver failure as well as a monitoring test. There was sort of the non-ceruloplasmin copper, but it is a calculation test and is often inaccurate, so it isn't a test that's sort of more routinely used in practice. But the concept is that there are tests that are desired to better monitor this disease besides a 24-hour urinary copper. However, that's the test that you would likely receive to monitor. And also in terms of monitoring is the ability to tolerate side effects of these medications, which I've summarized here, and I won't read them verbatim, but each of these medications have their own side effect profile, also summarized by Dr. A, that we monitor for. And most patients are able to tolerate these medications okay, but of course, on occasion, these side effects can occur. There are special circumstances whereby we consider a person with Wilson disease at risk for becoming sicker. That is when one who is considered a pediatric patient and is receiving care with pediatrician transitions to an adult teen. And so it is recommended that starting as early as 12 to 14 years old, that one starts to think about that transition plan because it helps to allow for time to prepare. Pregnancy is another consideration, and again, Dr. A talked about dose adjustments when it comes to medications during pregnancy, but it is the case that it is recommended to continue treatment due to the risk of both mother and fetus for uncontrolled disease during pregnancy due to stopping any treatment. And then liver transplant, which you will hear about forthcoming. This disease, separately from being a chronic liver disease, can at a given time either initially manifest or during the chronic disease degenerate into acute liver failure, and so that's also of concern. So this disease requires lifelong changes, and I've summarized the various changes that one makes here. So reduction in dietary copper, generally speaking, shellfish, nuts, chocolate, mushrooms, but reducing copper intake, copper pipes in the water can leach copper, but sticking with your medications, alcohol, staying hydrated, routine follow-up, and then screening first-degree relatives. All of these are changes in your life, and hopefully that some of them are one-time things and some of them you get used to. There are other diseases that require dietary changes as well, and so you're not alone in this way, but hopefully it's manageable when all said and done. So key points again. Number one, Wilson's disease is chronic. It requires long-term care. Number two, symptoms can improve, but it's not guaranteed. The liver disease, the neuropsychiatric symptoms. Number three, monitoring is through lab testing. Number four, special circumstances, pregnancy, liver transplant. Number five, it's a long-term life changes need to be done as well. Thank you so much.